Welcome to the Pain Live Peer Exchange video editorial series entitled Managing Chronic Pain, Practical Considerations to Improve Treatment Outcomes. I'm Dr. Jeff Gudin, Director of the Pain Management Center at Englewood Hospital and Medical Center in Englewood, New Jersey. For today's discussion, I'm joined by leading experts with a wide range of experience in pain management. Charles Argoff, MD, Professor of Neurology, Albany Medical College, and Director of the Comprehensive Pain Center at Albany Medical Center. Dr. Christopher Gharibo, Medical Director of Pain Medicine, Hospital for Joint Diseases, NYU Langone Medical Center, and Associate Professor of Anesthesiology and Orthopedics at the NYU School of Medicine. Dr. Vitaly Gordin, Professor of Anesthesiology, Associate Vice Chair of Chronic Pain, Director of Pain Medicine Division at Penn State Hershey Pain Management. And Dr. Joseph Pergolizzi, Naples Anesthesia and Physicians Associates Group, and Adjunct Assistant Professor at Johns Hopkins University School of Medicine. Thank you all for joining us today. Let's get started. Chronic pain, whether localized or generalized, is a widespread, often debilitating condition affecting more than 25% of adults in the United States. Neuropathic pain is pain caused by damaged nerves or nerves that are not functioning as usual. Often the cause of neuropathic pain is not completely understood, though often it can be traced back to disease or to specific types of nerve damage. Neuropathic pain includes pain caused by both central nerves, those in the brain and spinal cord, and peripheral nerves, those that extend out into the body. Cancer-related neuropathic pain is common and can be disease-related or related to the acute or chronic effects of cancer treatment. Cancer pain is often of mixed etiology, or, if purely neuropathic, may be one of several pains experienced by a patient. For these reasons, opioids are used more frequently in patients with cancer-related neuropathic pain. What are the pros and cons of anticonvulsants, antidepressants, SNRIs, SSRIs, and topical treatments for chronic pain? Let's talk to our panelists. Dr. Pergolizzi.
Well, Dr. Gudin, that's a good question. I think when I first think about the class of agents that you mentioned, with the exception of topicals, one of the concerns is the onset of action. And usually these take quite a bit of time to titrate to an effect. And a lot of times when a patient finally gets to see a pain management specialist, they're looking for some more immediate gratification. So it's critically important that you tell these patients to have the proper expectations. I think another potential limiting factor may be tolerability, particularly if we look at some of the patients who are experiencing neuropathic pain, non-cancer related neuropathic pain. They may be of an older generation, and they may be older in age, and therefore they may also have other comorbidities. So the potential for clinically relevant pharmacokinetic and pharmacodynamic drug-drug interactions exist because of the rational polypharmacy they're on. I think that these agents do provide a decent opportunity for our patients once you get them to a titrated effect dose. And when we look at topicals, I think topical agents in combination with a oral systemic agent may be a very good plan for these patients too.
So Vitaly, what do you tell patients about anticonvulsants or antidepressants, right? I mean, what's the typical response to a neuropathic pain patient when you tell them you're going to prescribe an antidepressant?
Well, the patient says, I'm not necessarily depressed. Or if I order, let's say, an anticonvulsant, they say, well, I don't have convulsions. So I have to educate the patient that neurons, which are responsible for neuropathic pain, they fire irrationally, erratically. And we know that antidepressants and anticonvulsants, they suppress the excitatory activity of those cells, which are responsible for the neuropathic pain.
So educating patients about treatments is something we do every day.
Yes.
Yeah. Hey, Chris, how do you feel?